Welcome back to Central News. For people suffering myopia or nearsightedness, they would be relieved to know that recent advancements in the optics industry now has options to slow the progression. Hamilton's Physique Rose Optometrist is the first practice in New Zealand to offer a myopia control clinic. Central News reporter Amanda Harper finds out how it works.
If someone is suffering from myopia, what symptoms do they have?
Most myopic or short-sighted patients, short-sighted means things close up are clear and things far away are blurry, will notice things in the distance to have a bit of blur. They may also get headaches, they may have eye strain, or they may notice their night vision is actually quite poor. And that's one of the few things some of the few things that you can notice to determine you might have short-sightedness.
Now, Physique Rose Optometrists are now offering myopia care control. What is this and how does it work?
So, myopia control is actually a revolutionary new evidence-based set of therapies which can actually help to slow down and stop people from getting worse from short-sightedness. In the past, we used to just innocently be bystanders and watch people as they were changing in prescription. Myself, when I was 2 or 3 years of age, I developed short-sightedness and I actually gradually got worse and worse. All that was done for myself was I was just offered new spectacles and new contact lenses. This actual therapy, the way it works is we you'll see a picture coming up on the screen very shortly. It's going to show about myopia control. The way it works is we know in our central vision, with glasses or normal contact lenses, the picture is clear. However, in our sides or our peripheral vision, as is shown on the diagram, it's actually blurry with a traditional soft contact lens or spectacle lens. How these therapies work to treat patients is they change the optics of the system, as we'll see in our second image coming up, and what that does is that makes the side vision clear. Now you and I can't notice that, but the brain notices it, and it actually turns the switch off essentially to stop people from getting worse. But mostly what we know from our research is that we can slow people down and in the interim stop them. Yeah.
Previously there was no tool available to slow the progression of near or short-sightedness. How do we know that this works in the long term?
Well, to be honest with you, look, we've got evidence for the last year or 2 years worth of research, and by that I mean we've got actual clinical cases where over the last 3 years I've personally haven't had a new entrant into a myopia control therapy get worse. Now, that's anecdotal. We've got some research that came out in 2010 that at least over 12 months, the first 6 months of doing a therapy, there's zero change, and between 6 months and 12 months, there is a possibility for change. What we do know overall from the research is that 2 out of the 3 available therapies in our myopia control clinic can slow people down by up to 50%. What that essentially means is, let's say I know that you're 0 now, and next year we've got a crystal ball and we can see that you're -10. That's just a number. What I'm saying, with 50% prevention of getting worse, we can keep you at -5. The third option, which is actually a spectacle-based option, is can keep us at about -6 or -7 in the same example. So either way, one of the 3 options can help reduce the prescription from progressing.
Does someone have to start using it when they first start getting symptoms in order for it to work fully?
Not necessarily. Basically, we start monitoring when we start noticing these symptoms, looking for a spectacle or contact lens prescription. When we start noticing, oh hey, it's actually rapidly progressing or changing, then we may discuss this a bit more. I routinely talk about this with any of my new short-sighted patients, just so they know what's going on. There are 3 options, just very briefly. One's a specially designed lens which you sleep in overnight. You take them out and you wear nothing during the day. The second option is actually a daily soft contact lens which you wear. You just put it in the morning, take it out end of the day and throw them in the bin. And then the third option is actually a spectacle lens which has been specially designed in Sydney. essentially all three options help slow down, and that's what this whole clinic's about. We've also we've got really good support from our local ophthalmologists, who are the surgeons of the eyes, and we're working with them to collect certain specific information. So when you come to the clinic, you'll have some appointments with myself. You may also have appointments with the other specialists in Hamilton.
With the night option, are they uncomfortable to wear?
Generally no. The reason why is because you're not blinking whilst you're wearing the lens. Usually when you're wearing a contact lens, whether it be hard or soft, if you blink you may be a little bit more aware of them. Soft contact lenses traditionally have been much more comfortable overall. However, I've worn both and I've found no difference in comfort once you're used to them.
Is this an affordable option?
It really depends. We've got there's a whole range of options, so it's not the most economical option to begin with, but over time it's actually cheaper than your spectacle or contact lenses overall, if we're just talking about the overnight option. The contact lens option and the spectacle option are still very affordable.
Stephanie George has been treated with Ortho-K for her short-sightedness. Stephanie, how has it changed your life?
Well, I can see every day. I don't need to take my glasses everywhere. With driving, I can see everything. It's safer. With uni, I can see all my lectures, all my lecture notes. I don't have to drag my glasses case everywhere.
Mm-hmm. And will you continue to use it for the rest of your life?
Yeah, absolutely. I feel like it's more convenient for me, and it's sometimes uncomfortable, but because you're asleep you don't feel it, so just the benefits really outweigh that.
Why would you recommend it?
Well, it can be cheaper in the long run. You don't have to keep buying glasses and stuff, and it's just easier for everyday use. You don't have to worry during the day about taking glasses everywhere.
Jagruut is back tomorrow night talking about vision after 40. That's the show for today. Thanks for the feedback that's been coming in. Don't forget you can always email us news@tvcentral.co.nz or visit our website tvcentral.co.nz. Thanks for joining me today. I'll see you tomorrow. I'm Katrina McKinley. Have a fantastic evening.
This has been an Alpha Media production, a division of Television Media Group.
Supporting local content so you can see more of New Zealand on air.